So I watched some videos about nursing. In some of the videos I see, people are talking about how much money they make as a nurse, what they buy, all these luxury items, all these fancy trips, fancy cars. And so it's kind of glamorized. They talk about the material things, but they don't talk about what it actually takes to purchase those things, what it actually takes to acquire those things. So if you go into nursing for the money, honey, it's not going to last. I'm telling you, it's not going to last. One thing I wish I knew before I went to nursing school was the importance of money. Like not taking out so many student loans. I have 3 college degrees and I took out a lot of student loans to obtain those college degrees. I have a degree in I have 2 degrees in nursing. So I have an associate's degree of nursing and a bachelor's degree in nursing. I also have a master's degree in business administration. So I wish that someone would have told me to really look into different programs, different employers that help pay for nursing school. My employer, I worked all throughout nursing school except for the last semester and a half. My employer had tuition assistance and I looked at it, but I never applied for it. Why? I just figured the amount, it wasn't a large amount. So why bother? But girl, that added up because especially me keep going back to school. For a while, I was a professional student. So I kept going back to school, going back to school, going back to school. And yeah, the tuition assistance may not seem like it was a lot then, but those amounts would have added up. So yeah, so if you work for an employer that has tuition assistance and you know you're going to work there after you graduate, go ahead and take the tuition assistance. Do it. That's free money. You're working there anyway. Take advantage of it. That's less student loans you have to take out. Also, apply for different scholarships. Actually, I did do this and I won a couple of scholarships for nursing. But like I said, I didn't take advantage of my employer's tuition assistance. Why? If I had a time machine, I would go back and use that tuition assistance. Okay. So another thing, sorry guys, I can go off on tangents. So another thing I wish I knew before I became a nurse was, and this is positive, how many great people, how many wonderful people I would meet throughout the years. I am by nature an introvert. I can be around people, but then I need times where I am not around people. But I have met so many amazing people in my 23 years of healthcare. People that I will never forget. Staff members and patients alike, and patient families. Because with nursing, yes, I am an introvert, and yes, you can be an introvert and be a nurse. You just need to know your limitations. You need to set, setting boundaries, but that's a story for another video. Well, no, I can talk about it. So, you need to set boundaries with people, but being an introvert, I'm good at setting boundaries because I know how much I can take. But even being an introvert, I have met some amazing people that I will never forget. Some amazing stories, especially, not saying the younger people aren't amazing, but I've met so many amazing older people. When I have time to sit down and ask them about their life, some of these people, oh my gosh, they've had the most amazing life. They've had some of the most amazing lives ever. Things I would never imagine that's possible. They've gone to places I didn't know existed. They've done things like, oh my gosh, wow, how truly amazing is that? So that's one of the positive things to know about going into nursing. Another positive is learning. Like, I've learned so much about all kinds of things, even like things outside of nursing, because the medical field it's always advancing. Even like when I first started in nursing, I look at all the advancements in healthcare, and I'm like, wow, I remember when we used to do this, and this, and now it's like, I remember when you used to have to do this step, this step, this step, this step, and now you just have to do this step and this step for a procedure or something. It's just amazing, the technology, and that I have been around to witness it. And I learned so many different things. I can say that I have learned, not every day, but almost every day I've learned something new, and that's amazing. So a lot of people think that nursing is like a 9 to 5 where you go in, you do your job, and you come home. Well, that's not really the case. Nursing is 24/7. People are sick at night. People are sick on holidays. People are sick every day. So you have to, in the hospital setting, so you have to have a nurse there to help take care of those patients. So there are some nursing jobs that are Monday through Friday, like 9 to 5. Then others are not. There are nursing jobs where you will have to work night shift. There are nursing jobs where you will have to work holidays, weekends. Have to work a swing shift. Like, you may have to work a day shift and then turn around and work a night shift. You may have to work where there's not enough staffing. So those are things that I knew going in, but not to the extent that I know now, if that makes any sense. The job I have now, I'm a nurse case manager. I work part-time. I work every other weekend, and I work like 3 days. I work 8-hour shifts 3 days a week. I work part-time, and I work every other weekend. But that was not always the case. When I first became a nurse, a lot of nursing, new nurses work the night shift. The night shift actually can be really cool, but then it can be hard on your body too. It can be hard too, because you're working at a time where your normal circadian rhythm is you want to go to sleep, but you have to be awake to work, to watch these patients. So that in itself can be very difficult. And a lot of times, especially if you want to work in a hospital, that may be the only thing that's available for a new grad. But the thing is, you get a lot of experience. You don't have like all the ancillary staff around, like management usually isn't around, and all the other ancillary staff isn't around. So it's usually, I'm not going to say quieter, because it's not, because on the night shift you get a lot of admissions, like a lot of patients come in, so you're busy, but it's a different busy than day shift. And like I said, I'm not saying that night shift is easy. No, it can be really, really, really busy on nights, but different because you don't have all the ancillary people around, but you still have a lot of things you need to do. And so night shift can be hard on your body because, you're working, let's say you're working 3/12s, you're asleep during the day and everyone is awake and people are calling you and you're receiving all these messages and people are out doing stuff. There's a lot of noise. So that interrupts your sleep. So when I worked night shift, I slept with a mask. I had room darkening curtains and earplugs. That's the only way I could sleep, because if not, every little thing would wake me up and I did not get quality sleep. And then on your off days, you may want to switch back and be up during the day and then go to sleep at night. That's kind of hard on your body too. What I used to do when I worked 3/12s is I would work 3/12s in a row. that first day I would sleep that night, usually the day before. Not all the way. I would wake up maybe like 3 o'clock in the morning, and I would stay up till maybe like 12 noon. And then I would sleep from 12 noon to like 5, and I would wake up and then work. And then that next day, so I would work like 7 to 7. So I'd come home, eat breakfast, and then I would sleep like 9 to 5. And then I'd wake up at 5, get dressed, eat dinner, and then go to work. And then I'd do that, until I was off. And then that last day when I was off and I finished working at night shift, I would stay up as long as I could, take a nap, and then wake up. And then I would be back on the regular up during the day, sleep at night schedule. So it kind of worked. But then, like I said, it is hard. It is kind of hard on your body. And another thing about it is like social life. Like people want to do things during the day, you're asleep, and you're up at night, and everyone is sleeping. Now, the thing I did like about night shift is I used to go to the grocery store in the middle of the night, like the 24-hour grocery stores. I would go and do things like that. Or like stores that open really early, I'd be there right when they open to do my shopping and then go home and go to bed. So that's a downfall with night shift. But like I said, it can be done and people do it, and some people prefer it. I ended up switching to day shift because it worked better for me. And let's talk about holidays. I still work holidays now. I do have some seniority, so I'm able to take most of the holidays. I'm able to take some holidays off, but I still have to work holidays. The benefit of working holidays is usually you get paid more. Where I work now, you get double time. You receive double your pay. So that's a benefit. So you work the holiday, you get paid more money. But then the downfall is you're working the holiday, especially like Thanksgiving and Christmas. And Christmas, if you have young children, you might, and you celebrate Christmas, you'll miss them opening their presents. So things like that. And a lot of times, if you are a new nurse, you're going to be working those major holidays like Christmas, Thanksgiving, New Year's, 4th of July. So you might want to factor that in. And then weekends. You have to work weekends. Now for me, working weekends is kind of not bad. I work every other weekend and I get off like around 4. So if I want to go out with friends and family, I'm still able to do that. But if you work 12 hours, you're getting off at 7. You may not get home until 8. It's kind of tough going out, especially if you have to go back to work the next day. So you may or may not be able to go out and do things on the weekends. So yeah, but usually you work every other weekend or like 1 weekend a month. So you do have other weekends where you can do things, but you may have to miss out on a lot of things. So something else I wish I would have known before becoming a nurse is dealing with so many different personalities. Like I said, I am an introvert. I do talk to people. I'm talking to you guys, but it's different. Like a lot of times I'll meet people who are extremely talkative and they just want to talk. And I'm like, okay, I just came in to give you, this medication, and I don't have like 20 minutes to sit here and listen to you talk. And then just different personalities, period. I mean, just knowing how to deal with people on a professional level. And some people can be angry because they're in the hospital and they take it out on you, even though you are not the one that made them sick. But they see you and they take it out on you. So having to deal with that. Families, dealing with patients' families who are angry because the patient is sick. And then, especially with my position where they're sick, they've had this major illness, but now you got to take them home. And they're not the same person that they were when they came in the hospital. So, dealing with patient families with that. Dealing with doctors. Now, Where I work now, the doctors, for the most part, are pretty good. There are some that are like, whatever, there are some that I'm like, I've been doing this for so long that I have very little tolerance for like arrogance and craziness. I just don't tolerate it. But, oops, sorry, I kind of hit my camera and it went in a different direction. But anyway, but just dealing with doctors, some doctors let you know that they're the doctor and you're the nurse and you do what they tell you to do, or else whatever. And then there's some doctors, that consider you part of the team. There are different personalities and how to approach them for different things. And one thing I used to do a lot of precepting. I used to tell the nurses I precepted, don't ever apologize for calling a doctor about a patient, especially if the patient needs something or you need clarification. I would hear so many times nurses calling the doctor, oh, sorry for bothering you. No, you're not bothering them. This is what they chose to do for a living. They are on call. You have a concern about the patient. You need something clarified. You need to report something. That is what you're supposed to do. You are doing your job. So don't ever apologize for doing your job. But anyway, that's off on a different tangent. That could be a whole nother topic. That could be a whole nother video. Doctor-nurse interactions. And like I said, I've had mostly positive, but I've had some negative interactions with doctors that I kind of didn't know. Because like I used to watch the medical shows on television, and it's like the doctors and nurses were like equal and blah, blah, blah. The doctors and nurses were equal. Well, that's not the case in certain settings. So where I work now, the doctors are pretty cool. They don't act like that. But I have worked in settings where the doctors were like, I'm the doctor and blah, blah, blah. And you're the nurse and blah. Anyway, so yeah, there's that aspect. And then, like, another thing that I wish I would have known is disease process. And let me explain. So, especially when you work on a certain floor and that's where you work, and you come in and you see these patients every day and they have a terminal diagnosis, that can weigh on you because the outcome and they may not know what's really going to happen to them. Like, of course, they've been told, but you have to process that. Like if someone tells you you have a terminal illness, it might take you a while to process what people are saying, especially like things that you have never heard of. You don't necessarily understand what, that diagnosis means. So that can be hard. You get to know these people. If you work on the same floor, you come in, you take care of them, you get to know them, and the outcome. So that can be hard. And then to be professional with them and to show compassion, but to keep it professional, that can be hard. That can be really hard. Especially when I was an oncology nurse with certain diagnoses, I'm like, oh no. And then I knew what was going to happen. And then just trying to be professional with that person and not just break down and cry, that was hard. So another thing is work-life balance. So people think because you work 3 12-hour shifts, oh man, that's a great schedule. I would be on my off days, I would do this, and this. 3 12-hour shifts, 36 hours in 3 days. A lot of people work 5 days a week, 40 hours. So think about it, 36 hours in 3 days. That is full time. So a lot of people think that, oh, you're off the next day, you can do this, that, or the other. No, you're tired. Nursing especially floor nursing, if you are taking care of patients, it is physically demanding. You are basically standing up for those 12 hours, running around, doing stuff, taking care of this patient, doing this, running off running to this room, running to that room. You're busy. You're busy. You're not sitting at a desk. If you're working on the floor, you're not sitting at a desk, on a computer all day. No, you have to do physical things. You have to do physical things. So your off days, you might just want to rest, and then you might just want to rest and kind of just recoup. And a lot of people don't understand that. They think you're being lazy. No, I'm trying to recover from running around for 36 hours on my feet. Sometimes missing breaks and not hydrating enough and not taking care of yourself. So no, it can be a good schedule, but then it can not be a good schedule. So learning work-life balance, what I would do on my days off and what I do now, I found, and actually this didn't happen until recently. I mean, not that I didn't before, but finding something else you enjoy doing and doing that on your off days. Like if you are into gardening, if you like cooking, if you like reading books, just taking time for yourself on your off days and doing things you really enjoy doing. That helps with work-life balance. And also, another thing that I wish I knew before becoming a nurse is short staffing. Guys, there is a nursing shortage. It was there before 2020 and is definitely here after, because after 2020, we saw a lot of nurses leave the profession. Either they retired or they went to different settings outside of direct patient care, or they just left nursing altogether. Like they are not nurses. And then the nursing schools, during what was going on, a lot of people may or may not have been wanting to go into nursing because of the state of our world at that time. So there was a nursing shortage. And like I said, there was a nursing shortage even before 2020. So because of this, you are short-staffed. And that in itself can be so stressful. Stressful for the nurses, stressful for the patients. And there's another perspective I didn't think about, but then it hit me. It's stressful for management too. We kind of think that management is out to get us, but no, it's stressful being short-staffed for them, because we're complaining. So the nurses are complaining to management. The patients are complaining to management. Ancillary staff is complaining to management because they need something done. The nurse can't do it. The patient's families are complaining to staffing, are complaining to management. So yeah, it's bad all around. It's not a win-win situation for anyone. The nurse, the patient, family, management, everyone. Because of short staffing, you may receive a lot of requests to come in to work extra shifts. And yes, that you can do that. It sounds good, but then you have to think about your work-life balance. It's like, okay, I'll work these extra 1 or 2 shifts every week, but then overall, how is my quality of life? You have to think about that. Sometimes, yes, the money, it can be good, and especially if it's overtime, but is it worth it in the end? But then you start feeling guilty because your coworkers are working short staff. But you have to take care of you, because if you are sick and not able to work, it makes things worse. So just think about that before you start picking up all those extra shifts for money. So another thing I wish I would have known about nursing is, I don't know, I kind of thought that nurses were rich. And you do make good money as a nurse. I do pretty good, but I've been in healthcare for a long time, and that's why I'm able to work part-time. And you can make a lot of money, but a lot of times, like, you see these nurses on social media driving all these luxury cars, and I have a luxury car too. I have a luxury car, but like I said, I've been doing this for a long time. So you see them, doing all this stuff, having all their designer bags and all that, and all these, you know, these trips and all this luxury items. But girl, those nurses are working their butts off to get all that stuff too. So I know, you know, a lot of travel nurses, they make a lot of money, but travel nursing is good. You get to go to different places, but you are going to somewhere new. And a lot of times, in my experience, the travel nurses got the worst assignments. That wasn't true everywhere, but certain hospitals I would go to as a travel nurse, they would give me the worst assignments ever. And so I worked my tail off for that money. Like I mentioned before, depending on what nursing school you go to, you might have to take out student loans if you're not able to pay for nursing school directly. So you have a lot of student loans and you're out buying all these luxury items. And I'm not chastising people, because I was guilty of it too. I bought designer purses, and like I said, I have a nice car, and I'm like, girl, pay off debt, pay off your student loans. Take that money, instead of buying this Louis Vuitton or Chanel or Chloe purse, take that extra money and put it towards your student loans, paying your student loans off. So yeah, you see like all these glamorized nurses on social media, and yeah, I don't know. I can't tell people what to do with their money, but in hindsight, I wish I could go back and do a lot of things differently. I would have done a lot of things differently, because I know what I know now, but I wish I knew what I know now back then. So another thing I wish I would have known before becoming a nurse is, I kind of touched on this before, but how rewarding it can be. And what I mean by that is, you, especially with direct patient care, you have someone come in with a disease process and you see them get better, and you can spend the time to educate them and teach them things that they can do to help themselves and to make healthier choices in life. And you see them do it, and you may see them again and they look totally different. They're healthy. They followed your advice, and you know you made a difference in their life, especially if they come back in and say, wow, nurse so-and-so, you really helped me through a difficult time in my life, and I really appreciate you. That is so rewarding, guys. At least for me, that is so rewarding, knowing that I made a difference in someone's life. So another thing I wish I would have known before going into nursing is continued education. Depending on the state you live in order to maintain your license, you have to take continuing education courses. These can be beneficial, but sometimes, I will admit, they can be a little tedious, because there are state requirements that you have to know, and you may have to know things that you don't do anymore, but you have to stay current with that. So you have to take continuing education classes to maintain your license. Like I said, it just depends on what state you live in. Some states require this, some states don't. The state I live in requires this, so I have to take continuing education classes in order to maintain my license. And don't forget, your nursing license expires every 2 years, and depending on what state you live in, you'll have to pay to renew your license. Some states, the renewal fee is nominal. Some states, it's kind of expensive. Just depends on where you live. So keep that in mind. Oh, another thing I wish I would have known before becoming a nurse is people asking you all types of questions. I'm not talking about patients. I'm talking about people out in the world, if they know you're a nurse. And Lord help you if you go somewhere in scrubs and people ask, oh, are you a nurse? And they'll just start talking about any and everything. And it's like, I am a nurse, but right now I just want to buy a cantaloupe at the grocery store. I don't want to hear about your rash and a place that I don't want to see right now. So yeah, you get all kinds of questions and people just telling you stuff that, okay, yeah, you know about it, but necessarily want to talk about it in Target when you're trying to look at candles or something, you know, just yeah. So I'm fortunate enough that I don't have to wear scrubs to work. I can, but I choose not to. That, you know, a lot of people don't know I'm a nurse. So, which is nothing wrong. I'm not trying to hide that I'm a nurse. Heck, I have a YouTube channel talking about being a nurse. I'm not trying to hide the fact. But sometimes I just want to go into Target and buy a candle, buy some makeup or whatever, buy some laundry detergent and leave. I don't want people coming up to me asking me medical questions. And 9 times out of 10, I can't help them. I always tell them to call their doctor because they, you know, I can't diagnose something. I can treat with doctor's orders, but I cannot diagnose. I'm not a nurse practitioner. So I have to I tell people that they need to go to their doctor. So, and then like, you know, I'm not able to listen to their lungs or listen to their heart. I don't carry a stethoscope. I don't use a stethoscope anymore. And when I was on the floor, I didn't carry a stethoscope around with me or a thermometer or a pen light. I didn't carry that stuff around with me. So I can't even do an assessment on you. So yeah. Or another thing is like if I had a family member in the hospital and I would go visit them, they would tell people that I was a nurse. Don't tell people I'm a nurse. Don't do that. That's not right. I don't like that. Because some people, depending on, I find that if they were newer nurses, they would be intimidated because they knew I was a nurse visiting a family member. And then some of the more seasoned nurses, they're like, whatever, I don't care. But yeah, don't do that, guys. Don't do that. And I'm more seasoned when people do that to me in the hospital. Like if I'm coming in and the visitor is a nurse, I mean, that's good, you know, be an advocate for your family member, but you know, don't do that. Don't do that. Another thing I wish I would have known before becoming a nurse is, girl, sometimes, and it may just be me, but actually, no, it's not. With our own health, we tend to ignore things because we think it's minor and it may be something major. So that's another thing that I wish I would have known before becoming a nurse is not necessarily that I've ignored my own health, but there's some things that have gone on with me that I should have gone to the doctor and I kind of just poo-pooed. I'm like, oh, I'm okay. And no, I wasn't okay. And yeah, so even though I am in the medical profession, I still need to look after my own health. And if I think there's something wrong, even if it's minor, I still need to go to my doctor to get it checked out instead of just thinking, I'm okay, I'll be all right. No, let's get it checked out to make sure that you know for sure that you're okay and that you will be all right. Because I did that and I ended up having to have emergency surgery. Yeah, because I did that once and I was actually pretty sick. So, and I had to have surgery and everything else. So, yeah. So don't ignore things that are going on with you. Get it checked out. So the last thing I want to talk about is something that has happened to me and that has happened to a lot of people. Is one thing I wish I would have known before going to nursing school is burnout and compassion fatigue. Yes, I have experienced burnout with nursing, especially when I did direct patient care. And I didn't have a good work-life balance. And there were a lot of things going on in my life that it was just too much. And I'll be honest, I would have a lot of anxiety going into work the next day, especially when I did direct patient care. Now as a case manager, I don't experience that anxiety. But when I did patient care, I did. And especially when I was a travel nurse and certain hospitals that I would go to and I knew I had to go. It was so rough because I just knew I was not going to have a good day. I would just have like anxiety. Like I'd have anxiety attacks before I would go to work. I would get off work. I would cry in my car afterwards. I had nothing left. I just was almost to the point where I had nothing left to give. Not everyone experiences this, but a lot of people do. And what I will say to you is sit down and find something that you truly enjoy doing. I touched on this earlier in the video. Find something that you truly enjoy doing outside of work and do it. That's something to look forward to. Like for me, I love to travel. So I would book vacations. That gave me something to look forward to. Something that I knew I can get through this shift because in 30 days I'm going on a cruise, or in 30 days I'm going on to this resort. I'm going on this trip. That would give me something to look forward to. And then, so that helped with burnout. And then I just reevaluated what I wanted to do with my nursing career. I talked about it in my first video, my nursing journey. I talked about it there. But like I said, I was to the point where I went back to school to get a non-nursing degree because I was going to leave nursing altogether because I was so burnt out. But I found another area of nursing that I like doing, and I ended up switching to that area, and I've been doing that for the past 8 years, I think 8 or 9 years. It's been a while, and I like doing this. So just know, especially if you are a registered nurse, that if you are experiencing burnout, there are other areas in nursing you can go in. You don't have to stay in a situation that is causing you stress or anxiety, that you are depressed, you can't function, you don't have a work-life balance. There's other areas of nursing you can go to. I'm not saying leave the bedside. There may be, if you like patient care, maybe there is a different area of patient care you can go into. There's all different types of areas you can go to still doing patient care. You may just need to get off, leave the area that you're in, and find something that you know you can do that doesn't cause you anxiety. You're not depressed. You're not having anxiety attacks going into work. Something that you truly enjoy doing and that you're making a difference. So yeah, so like I said, that's the beauty of being a nurse. There's so many different options. So yeah, that pretty much summarizes the things that I wish I knew before. Oh Lord, there's one other thing that I forgot to talk about. Bodily functions, especially doing direct patient care. If you don't like bodily fluids doing direct patient care, don't do it. Don't get into nursing. Well, not saying don't get into nursing. Don't get a direct patient care job, because you will have all different types of body fluids. You'll see it. It may get on you. You may smell it. You may see different colors that you've never seen before come out of a person's body. So if you don't like that kind of stuff, don't do it. Don't get into nursing. Well, don't do direct patient care. So I've seen all types of different colors and different things that have come out of patients. But the thing you have to remember, yeah, you see this weird looking fluid coming out of the patient. The patient is upset about it too. So you have to, you may be like, oh my God, what the heck is coming out of this person? You have to still be professional and have compassion, because the patient doesn't want something purple coming out of their body. They're disturbed by that too. So you have to, use compassion and, help keep their dignity and help them through this moment of their life. And then some things, there are certain smells that people produce and it may make you gag. So what I used to do, if I knew that a person had certain things going on, I would take, there's some things you can put under your nose to help combat smell, and I would put a mask on and I would go do what I needed to do, and it would help keep me from producing my own bodily fluid. I don't want to say what the word is, but then it would help keep me from doing that, and it would help the patient so they wouldn't see that I was in distress helping them, because that may make them feel even worse, that like, oh my gosh, I had this purple stuff coming out of my body, and the nurses, like, they're gagging and stuff, and they're like passing out trying to help me clean up, get this cleaned up. So yeah, so there's things you can do to help combat that. And then there's certain things that you may just not be able to tolerate at all. And if that's the case, if you have a coworker that can tolerate it, but they don't tolerate this, you guys can trade off and do like this. Say, hey, can you help this patient do this? And I'll help your patient do that. So you can do things like that. And that, that comes into teamwork too. Remember I told you about working with different people? That comes into play too. So, okay. So now I'm serious. I think that's it. If there's anything else that I can think of, the things I wish I knew before I became a nurse, I'll make a part 2 video. Thanks for watching. And if there's things that you wish you would have known before becoming a nurse, put it in the comments. And if you have any questions or things you want to talk about, put them in the comments. So, and you still want to become a nurse, watch this video right here where I talk about how to get into nursing school. Thanks for watching.